So I want you to imagine playing your favorite video game. You've been playing it on the exact same difficulty setting for, decades.
Right, you know all the cheat codes, you know where the traps are.
Exactly. You're totally comfortable. But then suddenly, without any warning at all, the entire rule book just changes.
The difficulty just gets cranked up to max.
Literally overnight, like you sit down, you eat a normal Sunday roast,
Yeah.
or maybe you just have a single glass of wine.
Just things you've enjoyed your whole adult life without a second thought.
Right. And suddenly you look 6 months pregnant with this horrible bloating, or you break out in this incredibly itchy rash out of nowhere.
It's terrifying when it happens.
It really is. So welcome to the Deep Dive. Today we are investigating exactly what is going on here. We're looking at how declining estrogen impacts your digestive system and why it's driving all this severe bloating and sudden food intolerances at midlife.
And this is such an important topic because it is a profound, literal, structural shift in how your body processes food. But for so many women experiencing these bizarre digestive rebellions, it just gets completely dismissed by their doctors as well, just getting older.
Which is so frustrating. We are pulling from a massive stack of clinical data today to figure this out.
We really are.
We've got insights from menopause specialist dietitians like Nigel Denby, data from the Cleveland Clinic, the British Dietetic Association. We really want to understand why your digestive system seems to just rewrite its own rules during perimenopause and menopause.
And I think we need to set the stakes right away on just how incredibly common this is.
Oh, totally. The numbers are shocking. So there's this recent UK survey presented at the Menopause Society. They looked at women aged 44 to 73.
Okay.
94% of them reported experiencing new digestive health issues.
94%. You are looking at a nearly universal experience at that point.
Yeah, it's almost everyone. And 82% of those women explicitly stated that these digestive symptoms either started or they got significantly worse, specifically during perimenopause or menopause.
Which is the part that nobody talks about.
No. Okay, let's unpack this a bit. It feels like we're always told about the hot flashes, right?
Right, and the brain fog. We hear about those constantly.
Exactly. But nobody ever pulls you aside and warns you that your stomach is going to completely rebel against you.
Because we tend to view menopause purely through the lens of reproductive hormones. Like, we just think of the ovaries and the uterus.
Yeah, that makes sense.
But estrogen and progesterone, they aren't just reproductive. They have receptors located throughout your entire gastrointestinal tract.
Wait, really? Like everywhere?
Everywhere. From your esophagus all the way down to your colon. They act as these master switches for your physical plumbing.
Okay, so when those hormones decline.
The mechanics of your digestion fundamentally change. The plumbing actually operates differently.
So let's start right there with the actual physical plumbing before we even get into the microscopic gut bacteria and all that chaos.
Good idea.
What actually happens to the digestive tract when those hormonal master switches get flipped off?
Well, the most immediate impact is on your gut motility.
Meaning the speed of digestion.
Exactly. It's the actual speed at which your intestines contract to move food through the system. Those hormones, they help mediate the smooth muscle contractions in your gut.
Okay, so it's a physical muscle movement issue.
Right. So when estrogen and progesterone levels drop, your gut motility just naturally slows down. The transit time increases.
Meaning the food just sits there.
It sits there much longer than it is supposed to. And when waste sits in your large intestine for too long, the colon just keeps doing its primary job.
Which is what, exactly?
Extracting water. It just continuously reabsorbs more and more water out of the waste and back into your bloodstream.
Oh, wow. So that explains the physical symptoms.
Yes. The biological result is extremely dry, hard stools, and just severe, stubborn constipation.
Okay, wait, hold on. I'm a little confused here. Let me push back on that for a second.
Sure, go for it.
Because I thought progesterone was a known muscle relaxant. We hear that a lot, right?
It is, yeah.
So if we are actively losing progesterone during perimenopause, shouldn't the muscles in the gut get tighter and actually move things faster? Like, why are we getting backed up instead of getting diarrhea?
That is such a smart question. And it comes down to the difference between a steady decline and chaotic, erratic fluctuation.
Okay, explain that.
You are totally right that progesterone relaxes smooth muscle. If the hormone simply dropped in a straight, predictable downward line, you actually might see a more uniform tightening of the gut.
But it doesn't drop in a straight line, does it?
No, not at all. During perimenopause, these hormones are wildly fluctuating. I mean, they spike way up and then they crash way down.
It's a total roller coaster.
Exactly. And this erratic behavior creates moments where things might actually move too fast, so you might have sudden bouts of diarrhea.
Oh, so you can get both. That sounds awful.
You can. However, as the long-term overarching trend eventually moves toward the withdrawal of both estrogen and progesterone, the delicate pacemaking rhythm of the gut just gets totally disrupted.
So the baseline just shifts.
Right, the baseline shifts towards sluggishness. And that leads to that profound, heavy bloating and the constipation.
Okay, so the lower pipes are moving slower. But what about the upper digestion? Because a lot of women also report a sudden onset of terrible heartburn during this time.
Yeah, and that traces right back to estrogen's mechanical role again.
Oh, really? How does estrogen affect heartburn?
Well, estrogen actually helps maintain the muscle tone of the lower esophageal sphincter.
The little valve at the bottom of the esophagus?
Exactly. When estrogen drops, that valve loses its elasticity. It physically weakens.
Oh, so it just doesn't close properly anymore.
Right, no longer seals tightly. So that allows stomach acid to just splash upward, which causes new or significantly worsened heartburn and acid reflux.
That is wild. And I read in the sources that the gallbladder gets caught in this crossfire too, right?
Very much so. The hormonal shifts actually alter the chemical composition of your bile itself. Well, estrogen influences cholesterol secretion into the bile. And as hormones fluctuate, the bile stored in the gallbladder becomes supersaturated. It gets highly concentrated.
And because the whole system is sluggish.
Exactly. A sluggish system means the gallbladder empties much slower, and that significantly increases the risk of cholesterol crystallizing into gallstones.
The mechanical pressure on the entire digestive system is just immense.
It's a complete structural overhaul.
Okay, so if the physical plumbing slows down, the contents of those pipes are obviously going to stagnate.
All right.
And when organic material stagnates, the bacterial ecosystem is going to change. Which brings us to one of the most fascinating physiological concepts I have ever heard of in women's health.
The estrobolome.
Yes, the estrobolome. Talk to me about this.
It is incredible. The estrobolome is a highly specialized collection of gut bacteria, primarily belonging to the Firmicutes and Bacteroides phyla, that are explicitly tasked with metabolizing and recycling estrogen in your body.
Okay, the mechanism of how this specific recycling plant operates is just mind-blowing. Let's break down the normal, healthy process first, so we know what's supposed to happen.
Okay, sure.
When your body circulates estrogen and uses it up, the liver steps in to process the leftover hormone, right?
Yes. The liver essentially attaches a chemical tag to the used estrogen. It effectively marks it for disposal so it can be safely flushed out through your waste.
It's just an elegant waste management system.
Hmm.
But then as that tagged estrogen travels down into the gut, the bacteria in your estrobolome actually go to work on it.
They do. They produce a specific enzyme called beta-glucuronidase.
Beta-glucuronidase. That is quite the mouthful.
It is, but think of this enzyme as acting like a pair of molecular scissors.
Okay, molecular sense.
Yeah. It physically snips the disposal tag right off the estrogen molecule while it is just sitting there in the intestine.
Wait, and once that tag is snipped off, the estrogen is actually reactivated.
Exactly. It bypasses the exit route, gets reabsorbed straight through the intestinal wall, and goes right back into your bloodstream to be used all over again.
Here's where it gets really interesting to me. It's like your body is a recycling plant. The liver puts the estrogen in the recycling bin to be taken away.
Right.
But these bacteria are literally digging it out of the trash and throwing it back into your living room.
That is a perfect way to describe it. And in a balanced gut, this is actually a highly efficient way to keep your hormone levels stable.
But perimenopause ruins that balance.
It really does. It triggers dysbiosis, which is a state where the gut microbiome becomes severely imbalanced.
So what happens to the estrogen recycling then?
Well, if the shifting bacteria produce too much beta-glucuronidase, you recycle way too much estrogen.
Which means estrogen dominance.
Exactly. This creates a state of estrogen dominance, driving things like heavy periods, incredibly tender breasts, and extreme mood swings.
Okay, but what if it produces too little?
Conversely, if the gut produces too little of this enzyme, it fails to recycle what little estrogen you actually have left.
Oh, so it makes the menopause drop even worse.
Right. It worsens the already steep drop in estrogen and deeply intensifies your hot flashes and your brain fog.
What's wild to me is that as estrogen drops, researchers are actually seeing the gut undergo a literal, what they call masculinization process.
Yes, that is a real scientific term being used here.
The overall diversity of the microbiome just plummets, and the specific ratio of bacteria shifts to mirror a typical male's gut microbiome.
And this functional shift changes how your body extracts energy from food.
Wait, it changes your metabolism.
Entirely. A drop in microbial diversity, specifically the altering of that firmicutes to bacteroidetes ratio, fundamentally changes your metabolism.
So what does that mean for the body physically?
This specific masculinized microbial profile is heavily associated with rising insulin resistance and the very stubborn accumulation of visceral belly fat.
Wow. So the gut ecosystem is literally re-engineering itself in the absence of estrogen.
Exactly. It is adapting to a new environment, but in a way that causes a lot of grief.
So if the ecosystem of the gut is changing so drastically, the borders of that ecosystem are obviously going to weaken.
Naturally, yes.
And this explains the next massive issue we need to cover. Why you might suddenly be reacting to foods you have safely eaten for 40 years.
The sudden emergence of food intolerances is highly distressing for so many people, and it all comes down to intestinal permeability.
Which people usually just call leaky gut.
Right, leaky gut. So estrogen is actually crucial for maintaining the tight junctions between the individual cells lining your intestinal wall.
Okay, so it acts like glue.
Basically, yeah.
Hmm.
As estrogen levels fall, those tight junctions physically loosen. Microscopic, completely undigested food particles and bacterial toxins can now just slip right through the intestinal lining.
And they enter the bloodstream.
Yes. And your immune system immediately spots these foreign particles and launches a massive inflammatory attack.
It's not just the barrier weakening either, from what I understand. Estrogen directly dictates the production of certain digestive enzymes, too.
It does. For instance, it supports the production of lactase, which is the specific enzyme required to break down dairy.
Oh, wow. So when estrogen plummets,
Lactase production plummets right alongside it. Suddenly, you find yourself with severe lactose intolerance in your late 40s.
just completely out of the blue. And then you have the histamine cycle, which is perhaps the most hidden, sneaky culprit behind these sudden, aggressive food reactions.
Histamine is a massive piece of this puzzle.
Explain histamine a bit for us, because we hear about antihistamines for allergies, but what is it doing in our food?
So histamine is naturally present in a lot of great foods, things like aged cheeses, fermented foods, red wine, but it is also a chemical released by your own immune system's mast cells during an inflammatory response.
And the relationship between estrogen and histamine is incredibly volatile, right?
It is a vicious cycle. Estrogen actively stimulates your mast cells to release more histamine into the body. But simultaneously, estrogen suppresses the production of diamine oxidase.
Or DAO.
Right, DAO. And DAO is the specific enzyme your body uses to clear excess histamine out of the bloodstream.
So let me get this straight. During the chaotic spikes of perimenopause, when estrogen is high, it is actively dumping extra histamine into your system,
Yes,
while actively blocking the exact enzyme you need to clean it up.
exactly. You develop this massive histamine backlog.
And this backlog manifests physically. You drink a normal glass of wine or eat a piece of aged cheddar, and suddenly your skin flushes.
Right, or you break out in an itchy rash.
Or a terrible migraine hits, or your abdomen blows up like a balloon.
It looks and feels exactly like a severe allergic reaction, but it is actually a histamine intolerance driven by a hormonal bottleneck.
It's crucial to distinguish between an allergy and an intolerance here, though.
Yes, very important. What we are describing are largely IgG-mediated responses.
Which means what, exactly?
These are delayed systemic inflammatory responses. They cause fatigue, joint pain, and severe bloating over a period of hours or even days.
Okay, so it's a slow burn.
Right. They are distinctly different from IgE-mediated responses, which are those rapid, life-threatening allergic reactions like anaphylaxis.
Okay, so I have to ask on behalf of the listener, the absolute elephant in the room.
Go ahead.
Do we permanently have to break up with cheese and wine? Or is this just a temporary perimenopausal glitch?
I have good news for you. For most, it is not a permanent breakup.
Oh, thank goodness.
It is really about managing your total toxic load.
Total toxic load. Okay, explain that.
During this window of hormonal chaos, your threshold for tolerating inflammatory foods just drops significantly. If you temporarily remove these triggers, you give the intestinal lining time to actually repair those tight junctions.
So you let the inflammation cool down.
Exactly. Once the hormones stabilize post-menopause and the gut barrier finally heals, you can typically reintroduce these foods in moderation without triggering that massive immune response.
Okay, that is a huge relief. But, I mean, while you're in the thick of it, these symptoms are severe. They're unpredictable, and honestly, they're genuinely terrifying.
They really are.
Digestive symptoms in midlife frequently trigger what doctors call cancer anxiety.
Which is completely understandable. Changes in bowel habits, sudden weight fluctuations, severe abdominal distension. These are all also red flag symptoms for ovarian and bowel cancer.
Right, so the fear is entirely justified.
Absolutely. Getting a thorough medical assessment provides massive psychological relief. It is a crucial first step in ruling out serious pathology.
But, and this is a big but, stepping to a doctor's office often leads right into the IBS trap.
Oh, the IBS trap is so real for women at this age.
Women are twice as likely to be diagnosed with irritable bowel syndrome as men. Yet, of the women suffering from these severe midlife digestive issues in the survey we looked at earlier, only 33% actually had a formal IBS diagnosis.
It happens constantly. A physician sees a woman in her late 40s presenting with bloating, erratic bowels, and abdominal pain.
And they just slap a label on it.
All too often, yes. They apply the IBS label to manage the symptoms without ever once investigating the wildly fluctuating hormones actually driving the condition.
That seems incredibly frustrating.
And it gets worse. The intense anxiety of navigating these unpredictable symptoms actively spikes your cortisol levels.
And cortisol is the stress hormone.
Right. High cortisol actually suppresses the vagus nerve, which is the primary communication highway of the gut-brain axis.
So the anxiety about the digestion actually makes the digestion worse.
Exactly. This suppression further halts digestion and causes genuine IBS flare-ups. It just compounds the problem entirely.
Okay, so how does a listener advocate for themselves in that exam room? How do they ensure their hormones aren't just ignored in favor of an IBS diagnosis?
You really have to explicitly force the timeline into the conversation with your doctor.
Give us an example. What should they say?
State clearly, these digestive symptoms began exactly when my menstrual cycle became irregular, or this severe bloating happens concurrently with my hot flashes.
Oh, so you have to connect the dots for them.
You must bridge the gap between gastroenterology and gynecology for your provider, because they often don't do it themselves.
But as we advocate, we must also be vigilant about actual red flags, right?
Yeah.
Things that require immediate intervention.
Yes, absolutely.
So what are the specific symptoms that should never, under any circumstances, just be chalked up to menopause?
The big ones are any presence of blood in the stool, whether it's bright red or dark and tarry. Also, unexplained rapid weight loss without even trying.
Okay, what else?
Difficulty swallowing, frequent vomiting, or extreme debilitating fatigue that accompanies the gastrointestinal distress. If you experience these, do not assume it is just hormonal. See a doctor immediately.
That is crucial advice. So once the red flags are ruled out, we are left with the mechanics of the estrobolome, the slow motility, and the histamine spikes.
Right, the hormonal fallout.
We need to talk about actionable solutions. We understand what is going wrong now, but how do we physically fix it? We don't just have to suffer in silence, right?
No, you don't. But it requires a highly strategic, multi-pronged approach, and it starts with specific dietary mechanics.
Okay, like fiber.
Yes, increasing fiber is essential, but we have to understand how it actually interacts with a sluggish perimenopausal bowel.
Because there are different types of fiber.
Right, exactly. There's soluble fiber found in things like oats, beans, and certain fruits. This actually dissolves in water to form a gel.
Okay, and what does the gel do?
It adds soft bulk to the stool, making it much easier to pass without irritating an already sensitive gut lining.
Got it. And the other kind?
Insoluble fiber. This acts more like a broom, physically sweeping material through the intestines to restart that stalled motility.
So you need both.
You do. Together, they feed the beneficial bacteria, which helps restore the microbial diversity we lose when estrogen drops.
Then there are phytoestrogens, right? The plant-based compounds found in soy and flaxseed that kind of mimic weak estrogens in the body.
Yes, but there is a fascinating genetic and microbial lottery regarding how effective they actually are for each person.
Wait, a lottery? What do you mean?
Phytoestrogens can absolutely help smooth out the hormonal cliff, but they only reach their full potential if your specific estrogen contains the exact bacteria required to convert them into a highly potent compound called equal.
Equal?
Yeah. If you lack these specific gut bugs, if you are not what they call an equal producer, then consuming massive amounts of soy will really only yield very minimal benefits for you.
Wow. So the efficacy of your diet is entirely dependent on the specific composition of your microbiome.
Exactly. It's incredibly individualized.
Now, a lot of people suggest trying a low FODMAP diet to identify specific food triggers.
They do, yes.
But I read that doing this without a registered dietitian is actually incredibly risky.
It is extremely risky. Long-term restriction of these fermentable carbohydrates literally starves your microbiome.
Oh, because you aren't feeding the good bugs anymore.
Right. So it drives you even further into dysbiosis. You must have a clear exit strategy for restrictive diets. You can't stay on them forever.
Okay, so alongside diet, what about mechanical and lifestyle interventions?
Because transit time is slowing down so much, aggressive hydration is absolutely required.
To prevent the colon from just sucking the stool dry, like you mentioned earlier.
Exactly. And managing stress through things like deep breathing or yoga isn't just about feeling relaxed. It actively lowers circulating cortisol.
And lower cortisol reactivates the vagus nerve.
Yes, which sends a direct physical signal to the gut to resume normal digestive function and lower localized inflammation.
Now, I was completely surprised by the next recommendation in the sources, pelvic floor physiotherapy.
It's a game changer.
But we typically associate pelvic floor exercises with, bladder control after childbirth. How on earth does that fix digestion?
It really comes down to tissue elasticity. Estrogen loss physically weakens the puborectalis muscle.
Okay, where is that?
It acts like a sling right around the rectum. If this muscle loses its tone and cannot relax properly, it creates a literal mechanical obstruction. It makes it physically difficult to empty the bowel fully. So a pelvic health physiotherapist helps restore that mind-muscle connection.
They rebuild the mechanical strengths required to resolve the severe constipation. That makes total sense.
It does, but it's rarely the first thing doctors recommend.
Okay, finally, we have to look at the hormone replacement therapy catch-22.
Yes, the HRT paradox.
HRT is the gold standard for resolving the root cause hormonal deficit, obviously. Logic dictates that simply replacing the estrogen should stabilize the gut motility and stop the estrobolome chaos.
And HRT is incredibly effective for this. However, the catch-22 lies in the initial adjustment period.
What happens during the adjustment?
When you reintroduce estrogen, the body's immediate physiological response is to fiercely hold on to water and sodium.
Which causes fluid retention.
And significant bloating. And this typically lasts for the first 6 to 8 weeks of starting treatment.
Oh, that has to be maddening for patients. You start a therapy specifically to alleviate your awful bloating, and the immediate side effect is just more bloating.
It requires immense patience and really good communication with your doctor. Many women just abandon HRT after a month, assuming it's exacerbating their gut issues.
When really their body is just calibrating.
Exactly. The body is simply calibrating to the new hormonal baseline. You just have to endure that initial adjustment window to achieve the long-term digestive stabilization on the other side.
It sounds like we have to tune both the engine, the hormones, and the exhaust pipe, the gut, at the exact same time. You can't really fix one if the other's blocked.
You are treating an entire interconnected system. You really can't separate them.
So to summarize this incredibly complex web, if you are suddenly dealing with unexplained bloating, gridlock digestion, or just new food sensitivities out of nowhere, you are not imagining things.
You are definitely not crazy.
The loss of estrogen really is rewriting your digestive rulebook. But by focusing on your estrobolome, managing your total toxic load, lowering cortisol to engage the vagus nerve, and working with your doctor through those initial hurdles of hormone therapy, you really can rebuild that ecosystem and take back control of your gut.
And looking ahead, this profound connection between our hormones and our bacteria raises an incredible provocative thought about the future of medicine.
Oh, I love where this is going. What is it?
Well, if the estrobolome is the true master regulator of how our body utilizes estrogen, the future of women's healthcare might bypass traditional hormone replacement entirely.
Wait, really?
Imagine a future where, instead of waiting for symptoms to hit in our 50s and just prescribing estrogen patches, doctors map and biohack our gut microbiome in our 30s.
Oh.
We could theoretically optimize the estrobolome's bacterial ratio so perfectly that the systemic shock of menopause is prevented before it ever has a chance to begin.
Biohacking the estrobolome to preempt menopause entirely. That is a medical frontier we can all look forward to.
It truly is.
So the next time you feel like the conductor has just walked off the stage and left your digestive orchestra in complete chaos after a simple glass of wine, it's not you, it's your estrobolome. Thank you for joining us on this deep dive. Keep questioning, keep exploring, and we'll see you next time.